behavior that we see as acting out and oppositional behavior and then punish that, what happens is that that deep-seated shame that it creates inside of them in the end becomes the root of other behavioral problems like conduct disorder, extreme rage because life is unfair. I'm already traumatized and now I'm shamed for my trauma-related behavior. And that those become the children, if the negative cycle go on, that really can become criminals when they are adults now, because their development of conscience is just totally shut down. If the children misbehave, she would punish both. So our older sister came to me and say, but that's not fair. My sister's misbehaving. Now I'm also punished. So that means the older sister gets angry and start acting out. But I mean, it can take a lot of your psychic energy. Now, if a child is the whole time looking for the same type of attention as a baby, they do not know the following, how to do that. They don't most of the time. And I mean, there are obviously children that are more severe wounded and less severe wounded, but in general, they don't have skills to make friends. They don't know how to do that in a good way, to show empathy. We've talked about that yesterday. Now, I mean, lots of them have not received any empathy, so they don't know how to do that. That feeling function is kind of shut down. To wait patiently for their turn. So that has to do with impulse control. Now, when they want something, they want it now, and they won't think about the consequences. Now, so the neocortical area of the brain is just totally switched off, and they go to lower subcortical areas where impulse control is a problem, because they don't consider the consequences of what they do. They don't know how to communicate anger in a healthy way. So we all know now that there's nothing wrong with anger. Now, what is wrong is that how do you communicate? What do you do when you're angry? Now, they don't, I mean, most of these kids have never seen a healthy model of how to handle conflict. Most of them come from households where conflict is managed by shouting at each other, by violence, by threats, there's no healthy resolution. So how on earth would they know how to manage conflict? Then another thing, and that also have to do with attachment disorders, is that appropriate personal space. They don't understand that often, especially if they have a disorganized attachment or an attachment disorder. Now, they're in your face. They don't understand what is appropriate in terms of space. And that has a big influence on other people, because it will irritate other people, and the lack of boundaries. Now, that might even bring more punishment. Things like to follow rules. Most of the time, if kids come from a dysfunctional, traumatic environment, there wasn't consistency in the home. So what was the rule today? And we will talk about that as we start to go to the solutions. What was a rule today when mom is not drunk? So today, I have to go to bed at 8 o'clock tonight. I have to pack my bag and stuff. Tomorrow evening, 8 o'clock, mom is drunk. Mom and dad is drunk. So there are no rule. I don't have to do that. I can go to bed whenever I go because no one watch. So, like that lack of consistency, and just imagine the unsafety of that. Or to respond kindly to someone that is hurt, because often when they are hurt, and that is one of the reasons I think why they are so, why the symbol of a band-aid in the playroom is so important for them, because most of the times they haven't received any gentle empathy when they were a young child and they got hurt, even if it was a minor hurt. And to enjoy the company of others. Now, so when they're older, like more towards preteen and teenager, like the relationship shifts very quick. So best friends change very quickly. because they just don't know how to enjoy and to be enjoyable company. The eye contact one is specifically applicable to attachment disorder, sometimes also a cultural rule of display rule, but I'm here specifically referring to attachment disorders now, and to read nonverbal communication. So if we are able to, they are very sensitive for nonverbal communication in terms of, am I safe or am I not? You know, if dad's face look like this when he comes home from work, I must rather go and hide in my room because it's not going to be a good night, or I might be smacked or something. That they can do, but in terms of personal space, in terms of in friendships or in the classroom, no, they're not good and acting towards that. The reading of that communication for them is a way to protect themselves, or to tolerate ups and downs in relationships. Now, that's something that we sometimes, because I also work with adults, this is ongoing theme in adulthood is that specifically a child who have a high abandonment sensitivity or have an abandonment complex, those kids are so sensitive for abandonment that if there's a little bit of distance in a relationship that's important to them, like let's say it's a girl and you know she texts a boyfriend and he doesn't text back within 5 minutes, then you know it's the end of the world, or he's busy with someone else. And I know adults that they will block that person because I expect from you to immediately respond to my needs like a baby. And obviously, I think, you know, a healthy skill is to know, but, you know, I am not the relationship, and have that. And we're going to talk just now about ego differentiation, but I have relationships, and I have relationships, some of them that are close, but the fact that there's a hiccup in the relationship, although it's bad, it doesn't mean I'm bad, or I have to stop existing or coping. But for them, it is the end of the world, especially in very meaningful relationships. So what happened then in high school years, and I mean, there has been kids, we all know, that have committed and succeeded in suicide or self-death because of a relationship with someone that broke down, specifically a boyfriend or a girlfriend. That they just can't tolerate that pain of the abandonment. Psychological problems, secretive, trouble trusting others, always on guard, always hypervigilant, watching, you know, where are danger. Okay, we've talked about the friends. Bossy, boss is one way to get control back, but it makes you unpopular in relationships. And then the parentified kids, now the absolutely your child that had to be the parent of a parent from a young age. So this is quite relevant in where we have a borderline parent, because a borderline parent is very much a child in an adult body. So lots of the children, even the girl that I talked about, my patient that say my mother don't have friends and I have to be a friend, and she's dumping all her problems on me. It's kind of also a parentification that yeah, and children, some children are very sensitive to pick up on the fact, it's intuitively, unconsciously, they pick up on the fact that the parent is not coping, or the parent have emotional or mental health problems, and they have to take charge. If the parent today is not coping, who's going to make sure that the younger brother and sister is going to school? If I think about borderline parents, that some days they wake out of bed, they get out of bed, and other days they just don't get out of bed. So in the morning, when there's just no breakfast ready, or there's just no, mum's just not available for help to help. Or, you know, some days when they come home from school, maybe the ER 24 is in front of the home because mum had a suicide. I'm saying mum, I mean, it could be dad as well, had a suicide attempt. Um, So especially the eldest kids, now they will be the ones that they are just, they don't have a choice. They are just put in this parentified position. Physical boundaries, they touch others also inappropriately. So we've talked about the physical boundaries, but add on to that is that all often, especially if there have been sexual abuse and their boundaries have been violated, they don't know what is appropriate and inappropriate touch. And then they want love, but they don't want love. And this is what is so difficult for, especially the foster parents and substitute parents, when they take this type of child in their care. So one of my child clients that was, like moved from the children's home to foster care position, when the foster mom made food for supper, the little girl, she's grade 1, she's not eating any veggies. She's just eating 2-minute noodles. That is what she ate at home before she was removed, and she's never had that. I mean, when do we introduce new tastes to a child? As a baby, now when they start eating veggies and purity and all kinds of tastes. Now none of that happened because of the extreme deprivation and neglect. So the foster mother, I don't know what she made, but she made some nice food. And then the child said, but she wants 2-minute noodles. And the foster mother said, well, you would love to have 2-minute noodles, but this is what I made for tonight. I can make some pasta tomorrow evening. And what she did is that, I mean, she ran out of the kitchen to her room, slammed the door, and had a little bit of a, maybe that would be more temper tantrum. I can't get what I want now. But I mean, they handled it beautifully. Now, and just said to her, but this is not how it's going to work here. We do hear what you say, but this is, like we're not going to eat just 2-minute noodles here. So they want to belong. But so often their behavior is the opposite of what is needed to belong. Now, they push you away and they want you close. Depressed lots of times. Okay, the next one is then changes to the ego structure and development. Now, you remember now, just to remind you, yesterday I made that drawing. Now, so here's the unconscious. There is the ego that developed out of that, and there is the persona. So when we talk about ego structure, we talk about this part. Now, the conscious part of the personality, that start developing at about age 3.5, if everything goes right. If everything don't go right, then there are a lot of challenges to that. So we are going to talk again this week. Later, when we talk about ethics, we're going to talk about why it's unethical to, in terms of therapy, to work with a child's pain if there's not a strong ego structure, and how we need to make sure that the child's ego is ready for trauma processing and all of that. Okay, the first thing is that often there's a lack of object constancy. Now, this has really huge implication. So I've talked about that already yesterday. And lack of object constancy, so lack of the ability to know that you are being held in mind by meaningful attachment figure in your life. They think about you, although you're not with them, and lack of ability to know that they keep on existing if you don't see them. And that is where the extreme separation anxiety comes from, not just from young kids that are dropped at the preschool, but it goes on now in primary school years. Sometimes even in high school years, you might still get that the child can't attend a school camp or anything like that. And even in adulthood, if there's a lack of object constancy, you might get an adult child that still need literally the presence of the mothers and objects. So, that normal adolescent task of separating from the parents and actually starting to see the parents as they really are and being critical towards them, and individuation, separation, uh, cannot take place. On the one hand, that's a normal developmental task, but on the other hand, I can't separate from you, because when I don't see you or connect with you as the object, then I get extremely dysregulated. And that confuse the parents, because on the one hand, like, you're pushing me away, but I'm not allowed to go away. So it's almost something like, I hate you, don't leave me, kind of thing. It's actually a book with that name. The lack of ability to self-comfort. Now, often they didn't have a transitional object. In my therapy room, it's always very interesting for me to see when kids bring their transitional object. Now, I'm talking younger kids now, to the playroom. And when also they stop doing that. So sometimes they bring the transitional objects, but they, like, forget it in the waiting room. Sometimes they bring it in the playroom, and the transitional object, the teddy bear, whatever, sometimes it's 3 or 4 soft toys, whatever it is now. Sometimes it becomes an active part of the play, like, so the teddy bear must sit here and watch what I built in the sand tray. Or one child put his I don't remember what it was, a dolphin or what, soft toy, put that in my Angus spinner so that it spins with the spinner and so. But it's interesting to see also when they suddenly don't bring that anymore. So the lack of the ability to self-soothe is a direct consequence of lack of object constancy, because it means that there is no internalized mother inside that can take over the soothing that the external mother did. And what we will see in children that have that as a result of trauma and unstable early childhood years is poor self-care in terms of hygiene, poor self-care in terms, they don't care about, like, bathing myself. Maybe I don't smell well, taking care of my hair. And then self-care also in terms of, what do I need? I've written exam and I've worked hard, but what can I do to be good to myself today? In general, they will go to the opposite of that. If you remember what I said yesterday about the split in the unconscious, that internal persecutor in the unconscious will work against the good mother. It's like a negative mother in the unconscious. So they will, instead of taking good care of themselves, which is such an important skill for all of us and also for kids, they will mutilate themselves, they will punish themselves, they will stretch themselves too far, they won't, like, oh, I need to have enough sleep so that I feel good tomorrow. They won't consider that and the consequence of not getting enough sleep and so forth. Yeah, lots of them didn't have a transitional object. Then the lack of proper ego development. So without a container, which is initially before the child had their own ego, in other words, before the age of 3, the container, the parent need to act as a container. The therapist can also act as a container. So the therapist can obviously help this with the stabilization of the ego by being a substitute parent figure in therapy. But what will help a lot is if the teacher and all the other adults that are involved in the child's life take that same position of a mirroring secure object. Now, okay, lack of object constancy is one thing, but lack of mirroring is something else. So the mirroring is, I see you, and I give language to what I see. And that need to happen since the child's a baby. So that is the thing of, oh, you like it to do this. You want to lie on my lap. You don't like your tackies. You do like this. So what you like, what you don't like, a reflection of the child's emotion. This makes you sad, this makes you happy. So being a mirror for a child, a young child who can't be their own mirror. One of the things that is said about the development of narcissism is that the adults that become narcissists didn't have any mirroring. So that is why, just for sake of interest, if I work with a child where I suspect that the parent or parents is or are narcissists, that when the parent come into my room, you will see that they are, I'm always going to say, fishing for compliments now. So they're very critique sensitive, but they want mirroring. So what they do is they will, if my session is 1 hour, they will take 40, they will sabotage my feedback about the child and take 45 minutes and talk about all their accomplishments. Now, so whatever it is, sport or in my work, I've seen, this and this and this and this famous person I have helped in my work, or I have run the comrades 10 times and I'm the free state champ. And what is interesting about that is that it's not that you've asked the parent about, like, tell me about yourself and all your achievements, but deep inside, because they're carrying a false self as a mask, and they're over-identified. The persona and the ego are over-identified. They don't know they're carrying the mask, but they did not receive enough mirroring. So a child that is not contained, in a way that they almost that thing of, but that like, if I fall physically or emotionally, there will be someone to prevent me from falling too far. There will be someone that pick me up. There's a container in the form of a stable parent or a stable caregiver or a stable teacher or whoever it is that will pick me up. Children also need more than one secure attachment figure. They actually need at least 3. I've had situations where a teacher act as a secure attachment figure to a child. For example, a child, like maybe a high school child, and the teacher might say to the child, maybe the child start confessing about stuff that happens at home, and the teacher might say, well, you can WhatsApp me anytime we need it. If the parent find that out, a parent with personality pathology, especially your abusive personality disorders, they all hell break loose. Now, like, they will force the child to stop that, to block that teacher. You're not allowed to talk to someone else about this because of the secrecy. So children that don't have that container, that don't have that security, feel like they are falling forever. Now, this is a very, very loaded statement, actually, now, if you think about that. Because that goes with annihilation fears. Now, feeling like you're falling forever is the opposite of feeling contained. And imagine you are in a lift. You go into a lift at a shopping mall, and that lift there's something wrong, and it starts falling at a very high speed. I can tell you that's a very, very scary feeling. I've been once long ago at Disney World in America, and there actually, I think it's Universal Studios, I don't remember, but they have this old building, and then you go into this pretend lift that's falling, and like, that's horrible. But this is emotionally what these kids are experiencing. There's just no one that hold them. And that brings enormous free-floating anxiety. And lots of times, these are the kids that we see in the classroom. They are uncontained. They have a deep need to go back to the womb. Now, that's something that we see all the time in the playroom, is children of primary school kids, for example, any age doesn't matter, but in their projections, they will draw a house in the form of a womb. They will take a cave, my cave in the Sandra work. A cave is a symbol of a womb, and put little eggs in it, or a small baby. So either they draw it or they play it out in their play. But Or they play out, like the therapist is my mother and I'm the baby, and climb on the lap of the therapist and want to be soothed. So, and why? Because that is the last time that they felt contained. Even if there was stress during pregnancy and stress hormones, at least, that they were held in the womb. Yeah, so it's extreme regressed behavior. Then another one that I think you might be familiar with is the try to provoke the teacher or foster parent to show the same behavior than the perpetrator. Now, this is also something that we need to discuss with adult caregivers of traumatized children, is that because of the law of repetition compulsion, now the compulsion to repeat what has happened in the past. And remember, as I've said, a compulsion is not something that's conscious. It's a deep intrapsychic need to prove to myself what I already believe about myself. Now, so if I believe that I'm worthless, that I'm despicable, that no one is, I'm unlovable, no one can love me, I'm going to try to provoke any adult to, in the end, prove to me that my inner belief is right. And that is why in therapy, we have to work so hard to address this inner core belief so that the compulsion to repeat the past becomes less, the power of the compulsion. So it's hard. Now, it's hard when a child really provoke, and a provocation is also a defense. Now, not to react on that. Okay, and they create the internal safe place for the ego. So that is the self-care system that I talked about yesterday, which is that defenses in the unconscious, where I told you it's split into two, the regress and the progress part, and the outside pain cannot touch them anymore because the defenses is in place. Inside, they are re-traumatized over and over. All right, so yesterday I mentioned, now one of the ways to protect yourself is to create a self-structured internal fantasy world that others might see as lying or hallucinating. Now, so we need to also kind of, like I said, frequently teachers and other adults and parents accuse these kids of lying, telling lies. And I always want to have examples, because many times they are not lying, they are living in an internal fantasy world where everything is safe, where things are the absolute opposite of how it is in the external world. So the fantasy is a defense to ego destruction. So for the ego not to be destroyed by the reality of what is really the truth. And it might look near psychotic. In other words, it might look like the child is, like hearing things, seeing things, hallucinating. And so if it really goes severe, but it is if it goes to that point where it becomes almost a psychotic depression, it's because the ego is so close to decompensation that an effort of the psyche to try to I was going to say, to stay alive psychologically, is to create these fantasies. They have extreme damage to the ego structure. So if you can think about abused children, if we could be in that child's house and we could observe everything that is said to those children, that happens to those children from very young, how they are punished, what words are said towards them, and what are expected from them and done to them, I think we would understand why some of them just have extremely low ego structure. They don't have any self-confidence. And add on to that, then, if they are also abused by the other adults, like teachers, or, the words that are said to them in the classroom, or that by whoever adults, or the way that they are disciplined when it's not a situation for discipline. Okay, so they often become affectionate and regressed when in contact with the perpetrator. Now, that is that thing of they want to know where the next shot come from. So as long as I'm affectionate towards a perpetrator, the chance that I will get hit or hurt in whatever way is less. But and you will see, we're going to talk about that when we do the stress profile. But what happens not when they have contact with a seemingly abusive parent, but what happened in the 72 hours after that? Often these kids, and that is something that really bothers me about, assessment in terms of, does a child have a bond with a parent? Like we have different places. For example, it happens in the Office of the Family Advocate in divorce cases, or when there's a custody battle or so. What you see in that time, when if a child is just only observed once or twice with a parent, is not necessarily the truth of the situation. Children really that come from abuse situations learn from very young they would rather misbehave in the presence of the more safe parent than misbehaving in the presence of a perpetrator. All right, so the behavior of being regressed can be transferred into adult caregivers after contact with the perpetrator. The hypervigilance that they often constantly are in, so there's no release of the trauma, all the physiological arousal, block positive relationships. The other interesting thing now is the lack of boundaries, the physical clinging, and new foster parents. And I mean, we know that it's a bit inappropriate now to call someone 5 minutes after you've met your substitute parents, you call them mommy and daddy. It's almost, and we, like we need to help kids with these boundaries. Like maybe there's something else that you can call them, but it's because it's not. It's maybe a need for, transference, a need for mother and father, but it's more, the most obvious reason is the lack of boundaries, the fact that I can call anyone mom and dad. Okay, then transference of hostility and accusations towards a teacher or foster parent. So, yeah, unfortunately, one of the things that sometimes happen is because they are protecting the biological parents, they might accuse the foster parent or even a teacher of what the biological parents do. It is extremely hard to face the reality of, it's actually my parents that do that. But I mean, that can bring quite trouble for a foster parent if the parent is accused of, for example, sexual abuse or stuff like that. Okay, I've already talked about this one. If they don't have enough protection of their ego structure, in other words, if the child needs to stay in a situation where it is unsafe, stay unsafe, when the child goes to school with the trauma-related behavior, they get harsh treatment there as well. And, like they are nowhere contained. That thing that I said earlier of feeling that you're falling forever, it can result in an absolute catastrophic breakdown of the ego structure and a permanent change in personality structure. In other words, really long-term damage that is very hard to impossible to repair. Now, so that's really something that whenever there are disciplinary proceedings at school, or team meetings about children in a foster home, children's home, wherever now, is, do we consider where a child's ego structure is now? And that's something that we can pick up in therapy sessions. So when when there is ego decompensation, what that means is the loss of the ability to maintain normal, appropriate defenses. So defenses and defensive behavior, the defenses that we discussed yesterday, for example, denial, compartmentalization, minimization, and others, provocation, and These defenses are in place, remember, to manage anxiety. So if sometimes when a child have very poor ego strength, we actually need to strengthen the defenses. And it's not something to break down. Now, it's something that will become less as the child becomes stronger and safer. And the child will become stronger and safer if the child is for a long term in a safe environment. So I feel safe at school, I feel safe at home, I feel safe at extramural activity, and I feel safe with my therapist. Then they will start making use of more mature defenses because they don't need the primitive defenses anymore. But the opposite is if they lost the ability to keep those defenses in place, that can lead to extreme depression, suicidality, impulsive suicide, effort, anxiety, and delusions. So in trauma, the whole of the child's energy is focused on self-preservation. I think, this is one of the most important things that is why these kids are often, they don't have energy left for learning and schoolwork and socializing and, like having fun, whatever, because their whole life, it's like living in a constant war. Now, the focus is on how do I stay alive? How do I stay alive psychologically, sometimes physically, but at school, how do I stay alive in the children's home or at home? Okay, and then in children 4 years and younger, they just have pre-verbal memory. So we've talked about the gaps in memory. So here is just one or two examples of how you would see poor ego structure in the center. We are going to talk again about that more extensively later this week. So what you can see here is the house that is a symbol of the ego. Interesting, a child once wanted tools in the play session. He was a traumatized boy of 4 years old. He asked me, do I have any tools? Because he said he wanted to repair the dollhouse. And what he actually was saying is, I want to repair my own ego. I want to repair my sense of self. So I had a screwdriver, a little toy screwdriver, and other types of tools. And he, by play action, not really used that to try to fix the dollhouse. But this is a typical situation. This is actually not exactly, it's reconstructed, but I once had a teenager that he wasn't coping at school. It came from the rural area, was put into school here in Bloemfontein and a hostel in grade 8. And it was clear from the start that he's not coping and that he was having extreme anxiety, having separate anxiety, phoning the parents all the time, and to the extent that in the end, the mother, they took him out of the hostel. Mom, come and stay here in Bloem, but he stayed in the school. And he started coming for therapy. And this would be a typical way in which he would construct how he feels. Now, so what you can see is there are too many threats for my ego. My ego is under extreme threat. And because he was in high school, he was old enough to give a name. This is my mother expecting me to get 85% academically. And this is the teacher expecting that. And this is what happened at our hostel and so forth. But, he was treated for his depression. He was under psychiatric treatment. But one day he wasn't hurt. He wanted to go back to the rural area and to his old school, and the parents refused. And what happened was that it's terrible. One day when the mom came home, so there was a time that the boy was doing his schoolwork at home because of his mental state. He took an overdose of pills, and he wrote a letter that said, Mom and Dad, this has become too hard for me. I couldn't function anymore, and please give me a beautiful funeral. Now, fortunately, the mom came in time, and he was, admitted in the ICU, and only then the parents became ready to see that this is not, the child is not, like he's not coping in this situation. We need to find something else. So, yeah, sometimes, sometimes why do we always almost need a tragedy before we listen to what kids say to us also? This is another one. So one of the traits of poor ego structure is when a sand tray, specifically if you look at sand trays, are totally flooded. Now, young kids do that. I mean, 2 and 3-year-old. But in general, if you have a child of 7 and 8 years old that keep on putting more and more and more and more miniatures in, now that's it. I mean, there are no meaningful relationships here. And then this one, what you can see here is there is a broken home. So that's a good thing to have as part of your miniatures as if you're a therapist, because a broken home is a symbol of a broken ego. And but you can see that there's a werewolf, there's lots of threat now, 3-headed dragon, another dragon, spiders that are symbols of negative mother, a scorpion, a very negative symbol in the sand, and the ego, the total threat of it. Okay, I'm going to do the core beliefs, and then we're going to watch a video of Heather Thorpe's. So when we talk about core beliefs, and that is often that's something that is more, a child needs a certain amount of ability to, a little bit more of an abstract thought to own this. So senior primary and high school kids, what do you believe about yourself because of what happened? So why is it important to take note of this? Because obviously it has a direct influence on how I feel about myself, how I live out why I do what I do. And if someone reacts towards me in a certain way, how do I interpret that with reference to my core beliefs? So I'm stupid. I'm not lovable. It's a very big one, especially when there was lots of emotional abuse. I'm not good enough. I always screw up. I think that's quite something that kids with ADHD develop, especially if the ADHD go untreated and there's lots of impulsive behavior. And I sometimes see that with preschool kids that are labeled in the end by all the children, even if the child wasn't guilty. Now, when something goes wrong, the finger point to that specific child. I'm worthless, a big one. I'm too overwhelmed to even try. So that goes to that life position of no effort, no failure, no humiliation. So this is your kids, typical kids that absolutely underachieve. Everyone can do this except me. I don't fit in. I've talked about the outcasts. My teacher like everyone except me. The kids are clever enough to pick up if an adult, I mean, they're quite sensitive towards the fact that the adult don't like them. And if a teacher pick on a child, I mean, sometimes you don't even need to guess about it because it's clear cut that the teacher is really almost bullying the child. I mean, that's why the child will start reacting and feeling this way now because of the words that they are told in front of other kids. Okay, so let's just look at the difference between, just an example of the difference between external messages and internal beliefs. So for a traumatized child, so remember now, children that grow up in good enough situations, they wouldn't interpret this message in the same way than a child who grow up in traumatic environments. So if the teachers say you must play safely, the child pick up play must be dangerous. You can try harder. The child, my best is not good enough. Because if you take the child's whole situation into account, yesterday evening there was chaos at home. Dad hit mom again. Like there was a lot of blood. The police came to our home, that type of thing. Nah, and I did complete my homework. It wasn't maybe the best, but I did complete it. But now the teacher just say you can try harder. So, and don't know, but like for that child in that specific situation, it was the best they could. You should have learned harder, the same type of thing. I'm not good enough. So unfortunately, our traumatized kids are prone to see the glass as half empty because their life story of chronic multiple incidents of trauma have proved that. If you would just listen, I'm stupid. Why can't you be more like the other kids in the class? All right, that one that I've mentioned quite a bit of. I'm stupid. I'm an outcast. I don't fit in. There's something wrong with me. You're old enough to do this on your own. But what if it's one of those days of it's not that I won't, it's that I can't? What if something happened as an internal trigger or external that no one has observed that made me regress? And today I'm not 7, I'm 3. So do we, and I've said it yesterday and I'll say it again, we always need to handle the child on their mental age. So to say you can do it on your own, on the one hand, in normal situations, we have a quote, never do for a child what a child can do for himself. But if we take the mental age and the regression as a trauma reaction into account, maybe that is not the right words to say. What the child might feel is, I'm alone and there's no help available. So there is the alienation again. How many times do I have to tell you not to do that? Well, I cannot change, so why would I even try? That relates to your kids that after they had a stress episode or after an episode of hypervigilance where they went into fight mode or whatever, they are the ones that also don't understand their own behavior. And now they are the ones that feel what is wrong with me. So we must be so careful for the shame. You are making me angry. I'm bad. No. Or love is dangerous. Okay, let's take, because we're going to watch a video now, let's take a quick 10-minute break till 9:15, and then we're going to listen to Heather Forbes. Okay, welcome back. So let's listen a bit to what Heather Forbes is saying. I will also later on show you on a website the resources that I was talking about. But let's listen a bit to what she say about this topic.
When I talk about trauma, I like to do a comparison because one of the things I think we always do is compare. And even though we're not supposed to compare, we still compare because that's how we make sense of the world. And so many times we want our one student to be like the other students because this student is disruptive, this student is non-compliant, the student is disobedient, disrespectful, all the words we put on, and we just want that student to be just like the other kids. Why can't he just be okay? Why can't she be okay? And so we're going to use two of my favorite, most fictitious children that I can design. The first one is Andy. Andy is the student that comes in the classroom ready to learn. This is the student that is fun to have in the classroom. This is the student next year or next school year, when you go down and you look at your roster and you look at the kids coming into your building, you're like, yes, we have Andy. I have Andy in my class. This is awesome. But why is Andy the enjoyable student? And so here's what we're going to do. We're going to talk about this also from a developmental standpoint. And I'm going to draw a purple line down the stage here. How many of you all are with the younger kids, so you know who Harold is, right? So we're going to draw a developmental timeline. And Andy is the student that comes to school ready because of something that's happened in the past. And so we'll start Andy's timeline from and I will say this, from a neurological timeline. We're going to start at birth even, because from birth, for the first 9 months of life, Andy has been in a womb of a mother who wants to be pregnant, a mother who's taking care of herself, is decreasing the stress in her life. And then Andy has this nice, easy birth. And then the first 2 or 3 years of life, Andy has consistent caregiving. Andy has this parent who is right there, or parents to engage and to love and take care of their physical needs. And then Andy goes through maybe some preschool years and then enters kindergarten and is ready. And then as Andy goes through the educational experience, even when times are tough, Andy goes back home and has someone to be able to depend on. There's predictability in Andy's life. There's certainty in Andy's life. Andy knows that things are going to be all right. Andy believes in people. And as Andy moves through this timeline and goes through high school, you know what Andy's looking? Andy's looking for the future. Andy wants to know, what am I going to be when I grow up? What am I going to do? And so there's this excitement of moving forward. And so that is the life of Andy, so that even though there are traumatic situations along the way, Andy's still okay, because there's been people in the life of that child and that student have made things all right, and has created, again, certainty, predictability, the whole idea that Andy knows I am okay and all is well. Everything is always working out for me. Those types of phrases and understanding of what life looks like keeps Andy on this really nice, succinct path. But we're going to be talking about Billy, and Billy is just a boy or girl. I use two gender neutral names. This is just to put a face to a child and to a student, so that we don't just be in this more laboratory experiment. We say, well, we have a neurotypical child and a non-neurotypical child. Like, these are children that we're working with. This is why I use the name Andy and Billy. And when I talk about then Billy's life, we're going to look at a very, very different developmental pathway. Now, if you are a high school teacher, high school administrator, and I'm starting here at conception, it might seem a little odd, but what I want to do is create a deeper understanding of why your high schoolers are acting out, why they're not showing up for school, why they're smoking pot, why they're doing all these things to try to get their body systems back down. So much of it actually does start here. Now, you may not always know this information. And again, if we have the school counselors and social workers and therapists, you might be able to get a lot more if you do some home visits. But just to give you a broader perspective, let's start then also at conception for Billy. What we have to see is that 9 months in that womb, it might just even be a mother who's just stressed out at her job. But there's a lot of drug abuse in this world. And so if you have a mother then that is taking alcohol or drugs, you then have a baby that is basically baked in cortisol, which is the stress hormone. You have a brain then that is developing in an environment that is very, very different than Andy. How many of you all are seeing children come into our schools for the last 5 or 10 years that are way more intense? The difficulty of them is increased, the challenges of them increased, and raise your hand. And I think that this is where this is really starting. We live in the most stressful time of human history. A lot of young families do not have family support. There's the drug opioid crisis as well. And so now we have kids early on whose nervous systems are going to be very, very different from our Andys. And if you have a student then that just has a very difficult birth, that's a kid that comes into this world that says the world's not safe, because from the child's perspective, it's not feeling good. You know, this might be medically necessary and absolutely in the long term, but think about it always from the student's perspective and the child's perspective that says, these needles don't feel good. This hospital room is cold. This surgery is an insult to my body. My body is flaring up. And so birth trauma, I've worked actually with a lot of Andy families who have Billies because of what happened early on in life. So always look at that as well. And then this is the child then that goes through maybe a lot of multiple moves, family situations that are crumbling apart, unpredictability, a lot of homelessness where that student may be going from one home to another home or living in a car. They don't know what's going to happen next. That's a sense of powerlessness. How many of you all have students who ask you all the time, what's happening next? What's happening next? And you say, we're going to do history next. And then they say, what's happening next? What's happening next? All of this, again, is that uncertainty. I don't know I'm going to be okay. And so Billy's life then continues in this pattern. Some kids, you know, everyone's going to be different. Maybe they had a good early childhood and things have been great, but then in middle school, they got bullied for a couple years. And I have seen that completely turn some students from an Andy into a Billy. And then as Billy moves along this timeline, this future is scary. This future says, I don't know how to be an adult. I don't know how to adult. Apparently that's a new way you say it, right? I don't know how to do adult. And so, what does Billy want? Billy actually wants to go backwards. And so I see this often. Then you might have maybe a student that you've done a lot of work with and things are going great. This is a Billy, and you think, great, this is Billy's senior year. Awesome. He's going to be ready or she's going to be ready. And then all of a sudden the senior year, what do? They collapse. Because you know why? That's perfectly logical. If I can just stay back a year, I don't have to go forwards. And so it's their way of saying, I'm not ready for the world. And so what we understand with our students is that chronologically, you might have a student who is 16 years old, but developmentally, how old is that student? Probably maybe 12 years old. And we want to look at then not just the chronological age for our students, but maybe also the developmental age, because that maturity has been interrupted all along the way. And so the ultimate question is this: why are Andy and Billy, two children who appear to be so similar on the surface, so drastically different at every level? And this is what I want us to see. It's the difference between these two is that traumatic piece.
There's this crazy idea that's blowing up on TikTok, and it's a concept called quantum jumping. Get this, proponents of...
So when I wrote the book, Help for Billy, I really emphasized how important it is to be able to look at our children from their perspective, as I've mentioned, but to really say, you know, one of the solutions is let's just ask our kids what they need. Like, what do you need? Some students will tell you exactly what they need, and they have some good insights. Some don't quite know how to verbalize that. But I went ahead and I did a little survey because I said, I want to know, what do children need at school to make learning better? Simple question. So I sent this out to my email network, and at that time it was mostly parents, and the parents then were raising kids with a lot of trauma. And so I asked the parents, I said, would you please give out this survey to your child anonymously, and let's see what the answers are. Well, as the answers started flowing in, it was so obvious to me that they started becoming categorized in 4 different areas. And the first area was their physiological needs. The kids were saying, I just need to have snack time. I just need to be fed. The second part was about safety. You know, make the bullies stop bullying me. I need to feel physically safe. The third part was about relationship, about love. You know, if I had friends, school would be better. I mean, think about that statement. If I had friends, school would be better. It's not always about the new computers and the Chromebooks and the things that we need for academics. Sometimes it's the little stuff too that we have to go, whoa, we can have to really work on helping our kids be able to connect as well. Because the self-esteem is also a big factor. And that's very logical. If you feel good about yourself, do you think that you'll do well in school? Well, yes. When a challenge comes up and you're given a math problem that is very challenging, if you know that you have the ability to do anything you put your mind to, you're going to be able to do that. But if you don't know you're going to be okay even, you're going to have a hard time putting that challenge out to yourself. And you're probably just going to throw your paper away or stomp off and say F you and leave, make your own exit out of the classroom. And these 4 factors are so vitally important for us to start looking at before we can actually do the learning. Now, for you all that had Sociology 101, this may look familiar. Look like Maslow? So I took the liberty to take Maslow's hierarchy and change it into a hierarchy of learning, to put it into the framework that we're working with in schools and say, all right, if we want to get to the top of the pyramid, which is the learning, this is the part where kids are motivated. This is about the ability to problem solve, to think through things, the memory, not just to memorize and retain it, but actually to retrieve the memory. Because when you are stressed out and let me ask you all this, when you guys are hungry and stressed out, any of y'all kind of go into crazy town? I know I do. Like, that's what the hangry commercial is all about. Like, you can't even be human if you're hungry, some of you all. So that's why I would make sure you guys knew to get snacks before we had the break. But seriously, you're not very motivated to sit down and read 15 chapters if you are hungry. You're going to go get some food first. We have to be able to take care of these bottom needs. And again, this is why I emphasize that this is also about a community effort to bring in some of the resources to fulfill this bottom pyramid. But the bottom line is this, is that if the pyramid is not satisfied for our students at the bottom, they're not going to be able to do the top. And that really shows the difference between Andy and Billy as well, is that when Billy comes in, Billy is completely dysregulated. Billy's at a place that there's no learning going on. Billy just needs to feel connected. Billy needs to feel that sense of all rightness. I think that when the family falls apart, the next line that our children have for safety is school. And that is the reality of the world we are living in, because families have fallen apart. And if we don't catch them in the schools, where are they going to happen next? Juvenile detention and then prison. And so which line do we need to really focus on? And again, that's why my heart's desire is so powerful desire to help our kids, to have that next sense of safety that says, I am okay. I have someone who connects with me. I know I'm all right. Now, those are my words, but I had a teacher send me a picture of a Post-it note because what she did, she put it out to her students. She said, okay, I'm going to do Heather's survey. She put it out to all her kids. I think it was like first or second grade. And she said, you all, on this Post-it note, I want you to answer this one question. What do you need at school? What do I not know about you? What do you need? And so here's one of the responses she got back. And it says, you are the reason I wake up in the morning to go to school. If you want to increase your attendance, then we work on the bottom part of the pyramid. If you want kids who are motivated, it's not just about a new curriculum or a new external reward. It's about relationship. It's about helping to bring down that stress level so that they can feel like they're okay, and then the learning takes place. So I've thrown around this word regulation. Let's kind of go through this. What is regulation? What is dysregulation? These are two terms that I want you to use in your everyday life, in your classrooms, in your building, in your conversations. So let's define them. Regulation, simply by definition, is the ability to experience and maintain stress within one's window of tolerance, generally referred to as being calm, focused, or relaxed. This term is utilized by literally every scientific discipline. So right now, hopefully you all are regulated. I see water bottles, I see coffee, I see some granola bars. You are sitting hopefully in a pretty comfortable chair. And so you're regulated. Now, if I were to ask you to stay here for 5 hours straight, you would be very dysregulated. So what is dysregulation? The experience of stress outside of one's window of tolerance, generally referred to as being stressed out or in a state of distress. It is believed that affect dysregulation is a fundamental mechanism involved in all psychiatric disorders. Now, that is a quote from Dr. Alan Shore. If you are interested in this material that I'm going through and want more in-depth, check out Dr. Alan Shores. He's really been able to take the work of John Bowlby, which is all about attachment, and move it into the scientific realm of understanding how the brain reacts. So he's just got some great content. But what he's saying here basically is this, is that if you have a student who has a mental health diagnosis or an educational diagnosis or both, which is typically the case, then you probably have a student who is chronically dysregulated. And so when we look at this from not the mental health standpoint, but just from an everyday working with our students, we have to say, if that student is being non-compliant or disrespectful or bad behavior, whatever it is, can we now just say, you know what? This is a student who is dysregulated. This is a student who simply can't get back to a place of balance. And again, let's go back and look at our Andys and our Billies. So even though you're dealing with a timeline down here, I'm going to come back here because again, developmentally, this has such an impact. When you have an Andy and Andy is right here at 3 months old and Andy is crying, what does the parent do with Andy? Picks Andy up and soothes Andy. Now the parent has this nice attunement and the parent knows, oh, that's a cry for rocking, or that's a cry for a diaper change, or that's a cry for food. And so the parent right there, through the context of relationship, helps that baby calm down. It's not just about the feeding. It's not just about the rocking. It's that baby goes through this high state of stress. And then through the relationship, the child calms down. So you have a child that's dysregulated, a little baby dysregulated, parent calms them down. The child then goes into a state of what? Regulation. Again, for you all that have raised children, in one day, if you have an infant, how many times you go from high dysregulation down to regulation? It happens multiple times a day. So what's happening is you're building this blueprint for this baby to know, oh, I can get stressed out, but then I can come back down. And ultimately, as that child moves down this developmental timeline, you have children then that learn to do it on their own. And so we have kids then like Andy that walk in the classrooms and they have a good sense of how to self-regulate. These are the kids then that can learn to take a deep breath. They can think clearly in their mind. They can think, oh, I'm okay. I'll just get home and talk to mom or dad about that. I'll be all right. So they have a skill set to be able to go through their day through states of dysregulation, but be able to calm them own selves down through regulation. Now, Billy, let's go back to Billy. Billy's 3 months in the crib and Billy is crying and crying and crying. And who comes? No one. Or the person comes and they pick up that baby and they're angry and they're stressed out and they can't calm the baby down. You cannot calm babies down if you are dysregulated. I actually divert on the story here. I was given a parent lecture at one point and it actually was a combination of home and school. And this foster mom came up to me afterwards and she goes, I just realized after you said this, she goes, I have this baby that's in foster care. And I noticed the other day, I was really upset and I was rocking and she wouldn't calm down. And then this morning I rocked her and she calmed right down because I was calm. She was starting to correlate when the parent is upset, they don't know how to calm, the baby's not going to calm down. Now, you all can relate to this. How many of you all have been in the middle of Walmart and you see a family there and the family is super tired and stressed out. It's late at night. They probably haven't eaten. The parent has this long list. One kid gets super upset and doing stuff and just reacting, being dramatic. And parent goes, calm down right now. Now, you all don't do that. There's a delay on that response. But do you see how ridiculous that is? You can't yell at someone to calm down, but it's kind of, again, it's not that obvious, but it's a little more subtle. So if you have a parent who is stressed out, then you have children that don't learn how to regulate. Now let's transfer this back to where it actually fits into your life. You have then a child that is dysregulated in the classroom. You actually are trying to calm them down and they just can't calm down. They don't have the body memory to be able to do that. And again, this is why middle school through high school, maybe even younger, we have kids that are what? Smoking pot, doing drugs, alcohol, video games, sex. All these things are external ways to try to calm down my internal system. You have students who are chronically dysregulated. So these are two terms that I want you to really use when you're referring to when a student has bad behavior. Say, wow, Billy was really dysregulated today. And I want you to use it in your classroom. So maybe you walk in on Monday morning and you've been stressed out and maybe you just walk in your class, you say, hey class, I'm a little dysregulated today. That's very authentic. And then you start helping kids to recognize when they are dysregulated. You want to really empower a student. Use these words because it gets away from the words that are so judgmental. Because Billy already knows he's, quote, the bad kid. But if Billy can start to understand, wow, I'm just really dysregulated. What I need to figure out how to do is how to get regulated.
If you learn how to tell a story, it gives you powers you didn't have in all sorts of places.
So let's take this terminology of regulation and dysregulation. I want to put it on a spectrum. And so on the left-hand side, we have hyper arousal. These are the students then that are dysregulated, but their behaviors are going to manifest in an outward expression. So these are the ones that are unable to focus. Now notice I said unable and rather than won't. And again, these are the terminologies that I want to start honing in on. In fact, my keynote that I'm going to give on Thursday is all about the language of trauma, how we can really start tweaking how we see things and how we write reports up and how we hear the communication from our kids from a trauma lens. So instead of won't focus, we say unable to focus because the student's dysregulated. Just like when any of us are dysregulated, you can't focus. It's just that Billy is doing it chronically all the time. Cannot adhere to rules, aggressive, resistant, argumentative, anxious, impulsive, risk-taking. These are expressions of behavior that are really the core is dysregulation. So on the flip side of that, then you have the inward expression, which is just hypoarousal. These are the ones, again, inward, so they're defiant, they're withdrawn, they're tardy, they're absent. They disassociate, which just means they shut down. Did you see those little boys in the video? They were just shutting down. They had no expression on their face. It's a way to say, this outside world is way too much for me. I'm just going to shut down in my own little world to make sure I'm okay. And again, those are the ones that come in and just sit there and do nothing in your class. It's not that they're lazy, that they're dysregulated. Again, these words, I want you to start fine tuning. And when you want to say, oh, Billy's just being lazy, well, maybe we just step back and go, maybe Billy's dysregulated. It is lazy. Sure, but what's the cause of it? Regulation then. What we want to do is help our kids get into this middle spot, because when you are regulated, you have a higher chance of being responsive, of being engaging, to be able to focus and be able to be calm. So we're always going to be wanting this behavior, but if we look at it from the lens of trauma, what we're going to do now is not look at it from a behavioral standpoint, we're going to look at it from a regulatory standpoint. So in order to get the behaviors that we ultimately want as the outcome, the process now is changing. The process will be about learning how to regulate. And that might be at a building-wide level. That might be at a classroom, just how you physically change the seating and the lighting and the things. And it might also be from an individual level. So there's lots of levels of figuring out how then to work with this whole concept of regulation versus dysregulation. And honestly, these two words can change everything. I worked at I went to a school, I'm from Boulder, Colorado, and I knew the principal and vice principal, and they asked me to come in and do just a in-service training. It was a K-8 school, and they had a lot of Billies at their school. And so I basically gave just what I just did right now and left. And I came back a year later, and they said, everything has changed. And I said, how has everything changed? They said, we finally just started looking at our Billies from a regulatory standpoint. We understand now it's about being dysregulated rather than being bad. And that was able to change how they then interacted with their kids. So negative behavior is a regulatory issue, not a behavioral issue. If we can start seeing it through this lens, this is where the magic happens. This is where we really can make the changes that we're looking for. So let's add in a little bit about the brain on this, because the 90s were the decade of the brain. And I think that that is our call to action. That is our call to say, we have to start taking the science and weaving it into how we do things with children, because now we actually have proof of how the brain does start to develop in a very different way and what parts of the brain the kids are using when they are dysregulated. If you have any naysayers in your school, or you're still sitting there not quite convinced, it's always the science, I think, that you can't argue with. You can't argue with science. And so how then can we take that concept of regulation and dysregulation and apply it to the brain? Well, you've got basically three parts of the brain. The outer shell of the brain is the neocortex. Now, the neocortex is a part of the brain that is all about higher order thinking. This is the part of the brain that really separates us as humans from the animal kingdom. This is where we have the ability to have abstract thinking. We have morals and ethics are processed up here. Judgment, good or bad judgment is processed up here. This is where we also have sequential thinking. Now, sequential thinking is important because so much of our disciplinary policies and models are based off of sequential thinking, right? So if A happens, Billy, then B will happen, and then C will ultimately be the result of all that. That takes sequential thinking. And what's important about that is when you are dysregulated, you're not in this part of the brain. So you can't actually think through these things. This part of the brain is also about right and wrong. And what distinguishes then the difference between Andy and Billy is that Billy is living more in the midbrain. And so the midbrain is all about not right or wrong, but win or lose. And so if you're in the midbrain, this is the emotional brain, this is the fear-based brain, this is the brain that says, I need it now, because time, by the way, doesn't exist. It's all about what happens in the next 15 seconds. Not about the future, not about the afternoon. Well, Billy, if you don't straighten up right now, you're going to have after school detention. F you. Because right now in my brain as Billy, there's not an afternoon. It's about right now. This is the part of the brain that it's all about making my life okay. So this is where the amygdala is. And the amygdala is the fear receptor. And I think it gets a bad rap, because it's also the pleasure-seeking part of the brain. And this is important to recognize, because sometimes we don't want to let Billy off the hook because he's just doing this because he's just being greedy, or he's just, we put some bad words around that. Because let's say Billy steals the chocolate off your desk. And you Billy, you saw Billy steal the chocolate. And Billy says, no, I didn't steal the chocolate. And you're like, Billy, you stole the chocolate. No, I didn't steal the chocolate. Like, he lies so well, you even start creating your own story. Like, you question your own reality. Like, oh man, I really didn't see him steal that chocolate. Who has kids who can lie? Like, right? Because it's all fear-based. It's all about, I have to protect myself. But it's also, I stole the chocolate because I just want to feel good. Now, you all have a story similar to that. You didn't steal the chocolate, but let me give you your story. So let's say at the beginning of the year, you decided to go on a, not really diet, but you want to go on a good eating plan. It was a lifestyle change, right? So your New Year's resolution was all about eating organic, no processed foods. You're going to eat salads. You're going to eat about energy. And then, I don't know, a week or so later, you got kind of hungry. And you're in the middle of the grocery store. And you know what those evil marketers do in the grocery store? On either side of the checkout, what do you got right there? The candy. And so you're like, ooh, I could use some candy right now because I'm pretty dysregulated. And so, but you have just enough of your neocortex to say, I'm going to get the peanut M&Ms because peanuts are healthy. So you take the peanuts and M&Ms and you sit in the car and you eat these peanut M&Ms. Now they have dye, they have all sorts of things in them. You can't even read the label of the package. I mean, you can't even pronounce it, but you are eating these M&Ms and they are so good. They are mighty M&Ms. They are awesome. They're magic. Now, your resolution was not to eat the M&Ms. So what are you doing right now? You are enjoying life, and it's all about right now. The problem is you wake up the next morning and you go, oh my gosh, I can't believe I just did that. What was I thinking? You weren't thinking. You were in the midbrain. It wasn't about right or wrong. It was about what I want, what I need right now. Now that's a kind of a cute example, but that's Billy all the time. And so you may work with Billy, and maybe Billy has a counselor or has done some group work, and Billy makes a commitment and signs a contract. Billy says, yeah, I'm not going to do that in class. And the next minute he gets into class, what's he do? The exact same thing he told himself he would not do because he's flipped now into the midbrain. So this is the emotional brain. Now, when we work with children and we don't understand their trauma and we don't understand the way that they're thinking and they're in that midbrain, they will easily shift down into the reptilian brain. So how many of you all have children you have either worked with or seen or been a part of that are aggressive? Raise your hand and move to, oh, that's a large number, that move to the violent edge. We're definitely going to talk about that because I think that's one thing that we don't talk about enough. And so much that we do actually moves our students from the midbrain down into the reptilian brain. Now, there are going to be some of the students, but it's a very small percentage that just in a millisecond will go from the neocortex right down to the reptilian brain. But for the most part, so many of our students, if you look at the what I call progression to aggression, you might have a student who's mildly upset, you throw in a consequence threat and they get upset and then you get into a power struggle. So now you're in the midbrain. Remember, the midbrain is about win or lose. So if you get into a power struggle with a student who's in the midbrain, very likely if you continue with that power struggle and you just push at it, they're going to move down into the reptilian brain. I've actually got a video that we're going to see how that actually works in real life. So Andy is the student then that comes to school and maintains that ability to be in that neocortex most of the day, or at least that is the driving decision maker. I call that top-down control. So this is the student who comes to class. They might get upset, right? They might have some emotions, some feelings. That's the midbrain, but the dominant brain is the neocortex. So the dominant brain is going to be the decision maker. And so Andy can process through the discipline. Andy can go, well, if I don't get this paper done and turn it in and sit here and focus, I don't get to go to recess. Well, I'm going to then get my paper done, even if I don't want to do it. You see, the dominant brain is going to make decisions that work for us. But Billy is in the midbrain. So I call that a bottom-up control. So this is the student says, well, I don't want to do the paper. And I don't care what they think. I don't care if I fail, but I'm going to recess. So Billy doesn't do the paper. And the teacher said, well, you can't go to recess. And guess where Billy goes? Out the door to recess. Because he says, you're not in charge of me, I am. So we have to start connecting with students in this midbrain. You know how you regulate the midbrain? How do you get a student from a bottom-up control to a top-down control? That's relationship. That's connection. That's understanding. Now, that all sounds nice and fluffy. There has to be some boundaries and there has to be some expectations. And again, we'll get into the depth of what all that looks like as we go through this conference. It's not something just to put out there in one sentence. You have to experience that. So I just also want to make sure, you know, this is not just some light, fluffy granola model. Like, you know, there's actually to have strong structure, to have strong expectations, to be able to handle Billy and say, no, that's not going to be the way it is, but we're going to love you through it. That actually is one of the best strategies as well, because that gives predictability. So holding some good boundaries and holding the rules is actually very important, but it's holding those boundaries within the context of the heart, holding that boundary to say, you're going to struggle when I say no, Billy. But you know what? We're going to be okay. But I'm still going to hold that boundary. I'm never giving up on you.
And I think trauma affects every kind of memory.
So here's the next thing is that when we talk about getting our students regulated, so many times I see people when I do consults in schools is that they have this child who's like in the middle of a volcanic eruption. And you all know what that looks like. Boom. And the first thing they say to Billy is, okay, Billy, just calm down. So that's really not effective. How many of you all have ever had someone tell you, just calm down in the middle of your rant? Like, how did that go? That couldn't have gone well. So it's really about learning to understand at what point do we use mindfulness to calm down and settle, but at what point we also need to be able to say, you need to let this out. You are a volcano, because once you have that kind of energy in motion, you can't stop it. You know, if you are jumping out of an airplane with a parachute and you decide halfway down that you really don't want to be doing that, that's a problem. Like you just have to continue on and filter through that and pull the parachute until you land to be able to get back on grounded territory. So what I want to say with this picture of the slide with the volcano is that, listen, if you have a student in that moment, and I've got a couple video clips that we'll see what that moment looks like. It's sometimes about maximizing to say, hey, you're upset. Let's get you out of this class and get you to a place that you can be able to let it out, let all that steam, and then be able to calm down. So I saw this little picture and I really liked it. It said, never in the history of calm down has anyone calmed down by being told to calm down. I didn't know there was a history of calm down, but I like it. So let's talk about when we understand where the brain is, what we just discussed, and put it onto more of what I call the strategy timeline. So here's my strategy timeline. Now, the before is when Billy is relatively regulated. And I say that right with gentleness, like relatively regulated. These are the things that we can do beforehand, strategies as far as mindfulness, like when we did the little meditation. Many of our sessions that you will be attending tomorrow and Thursday are all about the before. And when we look at this conference and we have a lot of people submit proposals, we are definitely looking for people that will give us those strategies about the before, because the more that you can do the proactive work, when Billy's, again, somewhat regulated, somewhat logical, there's so much that can be done to prevent the middle part. Now, what's the middle part? The in the moment. Now, this is the volcano. This is understanding that when this student is in this place of absolute eruption, this is not the time to give them a fidget to calm down. Like that's just not, because they'll throw the fidget, right? And so this is the time to learn how to do this a little bit differently. Now, if you all don't know the moment, I'll make sure you do the moment. Like the moment is the moment, all right? The moment. So this is where that student is in a bottom up control. We have to do our conversations differently. And that's why I talked about the left brain versus the right brain. This is all about right brain. When this student is down in their moment, and again, it may not be the explosive piece, but it might be that student is totally shut down. We have to learn then how to communicate right brain to right brain, which we're going to, again, give a couple examples around. So you will find then sessions then that deal with working to de-escalate students, how to help them not go deeper into the midbrain, how to process through that midbrain in that moment without agitating them further down into that violent place. And then the third part of this timeline is the after. Now, this is really important. When I do consults with school, we look at then how much work is being done after all of this. And what I find, unfortunately, and many of you all probably can relate to this, is that not a lot of work is done here, because once you get Billy calmed down, you got to get back to class and get back to what you're doing. Right. And then, so there's this constant, well, we got to get back to learning. And I get that, but I will tell you this, the more that you really work, and this is really, I guess, a message to administrators as well, the more that you can work on that after piece where you go back, and restorative justice is a great piece to be able to understand how to do things differently, how to restore, how also to teach better skills. Like when we talk about this developmental timeline, a lot of times Billy is not understanding how the world works. Billy doesn't understand hierarchy. Again, one of the things that kids learn in families, besides the family meal and all the things that come along with that, what Andy has in Andy's family is this structure of hierarchy. We have probably two parents, right? We have people in charge. We have adults, uncles and aunts. We have this family system that has these very strong hierarchy. And then the people underneath the adults are the children. And so Andy learns this sense of hierarchy that says, oh, people are in charge. You take that kind of blueprint for Andy and you put Billy in, and you put Andy into the school. Andy gets it, that there's a principal, that there's a vice principal, that there's a teacher. Andy fits into the system of the school pretty well because Andy has a blueprint for it. Well, you put Billy, whose family is complete chaos. A lot of times, who's in charge in Billy's family? Billy's taking care of mom. Billy's taking care of dad. Billy's taking care of the siblings. They had one teacher say that every day their student, high schooler, was 15 minutes late every single day, no matter what. And he finally stopped and said, Billy, why are you late? And she said, because I have to get my 3 siblings dressed and fed and to the bus and ready on time to get them to school. And he's like, okay, I'll see you 15 minutes late every day, sweetheart. You know, like, yeah, she's doing the best she can. So the point being that so many of the families that Billy is coming out of, there's no hierarchy, there's no structure. And so Billy doesn't even fit into the system. Billy balks at the system because it's unfamiliar. So the after part is then helping Billy to learn what hierarchy looks like, that people are in charge, and to show the organization of how the school works, because that then is going to prepare Billy once Billy moves on down that developmental timeline to a job where there's a boss.
You'll never make money by just working harder. Money is a reflection of your energy body.
This in the middle, I want to focus a little bit on this, because this is always, I think, the hardest part. And I've got some video examples that explain everything that I've talked about to this point. This in the moment part. This, I think, is the part that is very hard, because it's so different from the way that all of us were raised. It's so different from the way that we have always done things. And we're basically having to learn a new language. So let me ask you all this as a collective group. How many of you all had parents then that were really like focused on your heart? They were like right brain to right brain. And when you were upset, they would be like, you know, sweetheart, just tell me you're mad. I can handle it. You know, and they would come to you and they would say, I just want to know how you're doing. I just want to check in with your heart. How many of you all had that kind of parent? Come on, there's got to be a few. Raise your hands really high, because the rest of us were jealous. The rest of us, you know what we had? We had the parent that said, I'll give you something to cry about. Right? So our parents met us in the left brain. They gave us consequences. They gave us sequential thinking. They gave us they tried to pull the emotional piece on us, but it was all from a very logical standpoint. They gave us choices. And so I'm asking you all now to change how we do this when we interact with our kids, especially in that middle zone, in that moment of how then do you still hold boundaries collectively and have this nice structure, but you do it more from a right brain heart perspective. So this is so much about getting in that place of empathy. So much of what our abilities go through, you can't fix. There's just no fixing that. And I think it actually is part of their journey as well. Their journey is to empower them to find their way out of it. And so it's about just creating that emotional space. What you see in that little cartoon is all about just allowing him or whatever character that is, him or her, to be upset, just to feel. So much is giving our kids permission to feel. They have to find their way out of it, and they will. And this is where I have worked in this field of trauma for so many years, and I have seen students be able to come out of this, as long as they are given the support and the resources that they need, that they are able to find their way. In fact, so many of them find solutions that we wouldn't even know if we just sit back and ask them about that. So I love the last couple lines in here. She says, rarely can a response make something better. What makes things better is connection. So the next time that you move into that place to say, well, at least I want you to stop yourself. I want you to go, tell me more, or let me hear more. Let me just listen to what's going on. It's about absorbing that kind of stress that our kids are holding and just letting them know, they're, you know what? You are worthy. You are okay. You are part of this school. And I am so glad that you are part of this class family and this school. And you are an important part of everything that we do here, whether or not he's behaving or not. So when we connect, it is again, right brain, right brain. What does that mean? That means that we have to slow down. Actually, a teacher just came up to me and told me that he does Tai Chi with his third graders. I love that because it's getting them to slow down. We have to slow down. A lot of our kids, their auditory processing skills are going to be very much compromised. Again, you think about the family that Andy grows up in and the conversations they have all day long, and you think about the Billy family that we saw in the very first video where there's no conversation going on. It's going to affect the rate of speed that children are able to focus and be able to process language. So many of our kids, when they're sitting there and you say, okay, take out your piece of paper, and Billy just sits there and everyone else getting the piece of paper out, and you think, oh, he's just being defiant. You know what's happening? The processing is just a little bit slower. And he's thinking, okay, get out the piece of paper, and everyone's got theirs out already, and then he looks like he's lagging behind, then he feels like he's stupid, and all of a sudden he acts out. So there's a lot of testing that goes on with a lot of our kids. If there's any way to check out their auditory processing skills, that is another one to really think about. It's about learning the art of listening. And when kids are in that moment, I want you to explore with them. Like, oh, what happened next? What happened then? Oh, well, how did that feel? Like, you don't have to be a therapist. It doesn't take a mental health degree to be able to connect with kids. It's just simply saying, all right, let me just take a moment here to be able to check in with Billy. And so I'm just going to leave you with this list of words and not just read them out verbatim, but these are the things it takes to be able to right brain to right brain. Again, get out of that logic, that giving choices in the moment. Again, this is when we're talking about really in that moment, because if you go into that kind of thinking, you're going to have an explosion. These are the ways to really step back and say, let me just check in with Billy here. Does it take longer? Yes. But you know what? Sometimes not, because if you have an explosion and that child then disrupts the entire classroom, how do the other students feel? They're all stressed out as well, especially when you have lots of Billies in the classroom, because one Billy can unravel all the other Billies within a millisecond. Have you all seen that? So it feels like it takes more time, but you will be preserving the regulation of your class as well. So it's about learning to just be present. What does it mean to be present? I mean, that's kind of like the buzzword about being present. It's about being right here, right now, right? Right here, right now. When I had this, let me give you one of my own stories. So I was in school and I had about, I don't know, 10 or 12 kids I was working with, but that's one student was a classic Billy, and he went into fight or flight mode very, very easily. And so he went into flight mode and he ran out of the classroom. He was an eloper. He was about 8 years old. And I just happened to be walking down the hallway and I see him in the hallway. Now, this school was in downtown Orlando, Florida. And so it was right near the major highways, 2 major highways. And so when kids left the school, it was an absolute safety problem. But he had not left. And I saw him in the hallway, but I saw him eyeing the door, the front door. And I was like, okay, here's my chance to reel him back in. And so I just walked up to him, and I did have a relationship. I had a lot of them before. And so I said, hey, Billy, what's going on? I didn't tell him that he was breaking the rules, that he was going to get a consequence or points off his point sheet or anything on that level. Just right brain to right brain. And I said, looks like you're having a hard time. He takes a deep breath and he didn't answer me. I didn't expect him to answer. I just was there to reassure him he was going to be okay. And then I said, why don't you just come back to my office? You're going to be okay. You're not in trouble. Those are really great words. Like, you're not in trouble. We're going to figure this out. Basically, I'm saying that little voice in his head that says you're going to be okay. That's in his head. What's going on? I'm not okay. So I was I was trying to be that neocortex for him that says you're going to be all right. And so he starts to come. Then all of a sudden, another teacher comes out of the other room and she looks at Billy and she goes left brain to right brain. And she says, Billy, you're not allowed to be out of class. Get back to your class right now. Where do you think he went? Oh, back to class. No, he didn't. No, he ran out the front door. So this is why, again, it's so important to have all staff on board with this model to make sure that one person doesn't flip it the other way. So it's really about learning how to be present. When he was right there with me, whoops, I missed my slide there. When he was right there with me, I just had to be present. Now, was I scared of him running out the door? Yes, absolutely, because he has done it before. And he has a history of it. And so there's that patterning. But I couldn't be scared of him running out. I had to be where? I had to be right here with him in this moment, just to connect, just to do all these words that we've just had up there. What we got? Right? I just had to create that sense of security. Like, I'm right here. I just focused on relationship. I just was basically saying,